to introduce Chief Rita. Chief Rita is the founder and president of Amen Healthcare and Empowerment Foundation in Nigeria. Welcome, Rita.
Thank you very much. Is my slide up? Yeah. First, I'd like to say a big thank you to the N Fund for this opportunity to be at such a great gathering, and for the opportunity we have had to be able to impact in communities. I'd like to go quickly because I have a very short period. And we're talking of integration of NTDs with other diseases. We realized very early that there is a need to integrate because it's cheaper. As most of you know, neglected tropical diseases are viral, parasitic, and bacterial diseases that mainly affect the world's poorest people. These include, I don't need to go to all that, you're all very knowledgeable about that. Now, what have we done in our effort to harness integration opportunities? Integrating the management of various diseases provides seamless services, make them more accessible, easy to understand and use, and lead to better overall patient care. Integration then aims to improve care and support for people who use services, their carers, and their families. It also reduces costs, as 2 or more services can be provided by a caregiver in one facility. And that's the example Carol gave us, which makes a lot of sense, because it's so expensive for people to even access healthcare. So for them to have multiple, visits makes it even more expensive. NTDs are community-driven programs which deal with those at the grassroots who present with other ailments apart from NTDs. Close and regular contact with them reveal that they seem to have more pressing needs for other interventions. The need for integration therefore became imperative. Because when you go to them, some of them will tell you, thank you for the NTD medicines, but I have a headache, or I have this pain, and especially now that we're doing the MMDP, we're seeing how people are ill from the consequences of NTDs, how people have hydrocele, elephantiasis, and all that. Some are already blind due to onchocerciasis. So there is really a need to have all these programs put together in such a manner that it will not be, too taxing for both the providers and the beneficiaries. In the case of NTDs, providing TT and hydrocele surgeries and management of elephantiasis has further promoted the program, as those truly neglected are now receive care. Provision of other interventions like distribution of glasses, cataract surgeries, breast, cervical and prostate cancer, screening and management, together with skills acquisition programs, have gone a long way in promoting integration of disease management, as all health programs take place in the same facility. This leads to a reduction of costs to the funder and the clients, who can access various care under one roof. Now, what have we done in terms of harnessing integration opportunities, to external health sector? As we all know, water and sanitation play very important roles in the elimination of NTDs. Integrating these becomes very important and imperative. It is evident that ill health brings poverty. Providing skills empowerment to those who have been impacted is also our priority. To this end, those impacted and the general public are taught skills to help them generate income and to improve their general well-being. And we have seen how this has actually transformed lives. We have instituted three skills programs, one for the general public, one for those who are blind from onchocerciasis. They are taught to make various things like mattress, pillows, beads, and they have become, more active, and they are able to generate income. The second skill we have instituted is for those who are impacted and this is with the great support of the End Fund. We were able to get Act Foundation to support us on this. So those who have been sick, who have lost their jobs, or who have not been able to go to farm for the reason of hydrosil or whatever, are now being trained to learn different types of catering work so that they can do things under their roof. And the third one is for the general public. So anybody that feels a need to be trained takes part in that, and we train them on various things: bar soap, liquid soap, body cream, perfume, sanitizers, and various other things. And of course, since we have been implementing NTDs since 2015 in Gombe and 2018 in Osun State with the support of the End Fund, this is what we have recorded with other programs that we have been running. We have we've done 52,601,362 medicines have been delivered, and then for hydrosil, you can see we've done 2,313 for LF management. We are managing 803, and it's ongoing. Our case finders are in the streets, going from house to house to identify people who need this. For TT, we've done 1,309. We've distributed 13,559 glasses. With the help of medicine donation program, we were able to distribute 55 wash points across the state, and we've done 1,941 cataract surgeries. 3,068 persons have been trained in various skills, and 17,619 persons screened and managed for cancer program. And so, what I'm trying to say is that we've been able to bring so many programs together, even under the same roof. At the specialist hospital, we have a section there that is looking after people who have elephantiasis. We train them. So when some people come, they are referred. We have a section there that is dealing with cancer, breast and cervical cancer screening, and we're also supporting other programs within the hospital. And this is replicated on the local government levels. We have cancer center in all the local government centers, and we have the health workers there who are ready to receive people who have hydrosil, have them enlisted for surgeries. Those with elephantiasis, we have home-based care. We have 14 people with the support of End Fund and Act Foundation who go from house to house to find such people, and we do home care. And those with sores, because we find a lot of people with a lot of sores, we have special powder, and we have our health workers go within a day or two in the interval of not more than 3 days to manage them. And so far we've been able to do an integration of so many diseases at the same time. Of course, the challenges we have, inadequate funding for cancer eye care, empowerment programs remain a challenge. We continue to explore all opportunities, including counterpart funding and collaboration with other partners or individuals. What are our expectations? We expect that the End Fund will continue to support us as we move towards eliminating NTDs. We've made a lot of progress. We've passed pre-task in 8 LGAs. We have another 15 that are due. We have 8 LGAs ready for task 1, and we have just done the EPID survey for Gombe State. We're going to do the one for Osun State by the middle of June, and we are expecting great results. We think we are making a lot of progress, and I want to take this opportunity to thank the End Fund again and again. As I said, we believe in advocacy from the highest level to the lowest, because NTD is a community-based program, and you cannot shave a man's head behind you. You have to go through the community leader. That is one of the others, the Royal Majesty, who is receiving the medicine, and that is an emir, the emir in Gombe State, who also, that's Louis there, holding the tray. And with innovative diseases, you can see our people, those we train, they do home cleaning, they teach the people how to manage the feet. We provide everything they need, so they don't have to go looking for the buckets, for the soap, the towel, the Dettol, the cream, antifungal cream, even the powder, the health worker has it and goes there regularly. So these are our people working, and for cancer program, that's a screening going on there. For eye care, this is TT surgeries being done there. And then for skills empowerment, these are blind people who have been trained to learn skills. These are skills programs we work in various places. And of course, as a result of what we're doing, the communities have really appreciated the N Fund and us, because we are the messengers. I always tell them the N Fund is the master. We are only messengers. And so we've received a lot of awards. I have received 10 on behalf of the N Fund, because it's not mine, it's for the N Fund. And Ellen has received 1, but they are waiting for you, because yours is more. And in Bombay, we have received 3 on behalf of the N Fund. So all of you in the N Fund are chiefs.
Thank you, Chief Rita. A lot of passion, thank you.